Welcome to the Growth Bridge. I'm your host, Ivo-Castillo, here in Miami, and this podcast is for entrepreneurs and leaders with strong ties in Latin America who want to understand how Anglo founders think about growth, marketing, leadership, and decision making, and how to apply their mindset in your own business. Today, I'm excited to have Michelle Bolton. She is the founder of My 911. Hello, Michelle. How are you?
Good morning, Ivo. Great to join you this morning. Thanks for having me on. I appreciate it.
Thank you to you for your time and your knowledge. My first question will be, Michelle, tell us a little bit about your background.
Okay, well, my background is not originally in healthcare. It's actually in farming. I farmed for about 30 years alongside the career and wealth management with a large firm here in London. And then, I ended up having some health issues in 2018 that actually were a huge reminder of the battles that I struggled with in my 20s. So I had a lot of emergency surgeries in my 20s and ended up having to ultimately face my own mortality at age 30 and say goodbye with a completely unexpected diagnosis of teratoma. So it was a large tumor in my chest cavity that they had to remove, but they didn't know, Evo, if they could actually save me at the time because it was so large. So, when I did get to, 2018 and started having other health issues, it just was kind of something that brought everything back to me. And every time I'd go into the doctor, they would ask the same series of questions over and over. And I just got really frustrated and decided to go home and create our customized wallet cards for healthcare that we now use to avoid the repetition and the frustration that you go through when you are constantly asked those same questions, when you go from registration to meeting with the nurse and they ask those questions again, and then you're meeting with the doctor and they ask the very same questions again. And it's to streamline medical communications and just reduce the frustration and just provide greater awareness at the time when you're in an emotionally difficult state.
Yes, wow. That's very inspiring. I guess that was to lead you to create My 911.
That is exactly what drove me to create this service because I had been there enough times of emergency surgeries and different things like that. And I was just really tired of it. I was really frustrated with it. It was just to solve my own problem, right? It wasn't really, something that popped in, oh, I'm going to do this for business because I was already very happy in my wealth management position. And having a really good time. I loved our clients and the work I did, but this called me in to do work for a greater purpose, basically. So it wasn't something I really thought about doing. It just called me, and it ended up being my purpose. So how do you deny that, right? Like, how do you
Yeah.
not do that work?
And I guess it's hit you like a click. You know what? Like, this is it.
It totally clicked. It totally was something that, the moment just like, yeah, this makes sense, right?
Yes.
Yeah.
Yeah.
So it is
And
something that you don't always expect when, you're not looking for it.
yes.
So,
And can you tell us a little bit about what is it? What is it?
yeah,
What
of
is
course.
the core of Mine 911 and what value brings to the customers?
Okay, sure. So basically, it is a service that provides these customized wallet cards for healthcare, and they display a QR code on the back of the card that is linked to your online emergency profile. So, excuse me. So basically, what happens is when you go to the doctor or you end up in an emergency, you've basically pre populated that card, right? With the information that you're always asked when you go to the doctor or you have a doctor's appointment, if you have allergies, underlying conditions. So
Yeah.
basically, yeah. So what we do is we provide customized wallet cards for healthcare for members that display a QR code on the back linked to their online emergency profile. So if they go to the doctor or they have an unexpected emergency situation, the information that they have pre-populated on their profile, their emergency profile, and their wallet card will provide that awareness to emergency responders and the doctors in terms of allergies and underlying conditions and emergency contact information, anything that is pertinent to your medical profile, because we're all individual, right? We all have a very different medical profile. So, what you have on your profile, Evo, is going to be very different from what I have on mine, of course. So instead of having to repeat yourself, when you go to these appointments or fill out all the forms, you have your card handy and they can just, scan the QR code like any other QR code. But what that does is it brings up a summary of the information that's important for you so that they have a better awareness of the information that they're going to need to either, help you with your diagnosis, or if they have to prescribe new medications for you and you were allergic to something, that would at least tell them that, right? So that they could avoid any other reactions that you might have to be dealing with if they did give you something that you would react to. So I think having greater awareness around what your information is, certainly, if you, let's say you can't even communicate, right? If you're unresponsive, they need to know. How do they know? And could your loved ones speak on your behalf, right? So if you're alone, or if I know families where the spouses don't know what their partner is taking regarding certain medications. So you have the ability with our service to update that in real time as your situation changes.
Look, now I am having situation. I have my father in the hospital in Peru,
I'm
and
so sorry.
he found him 7 arteries in his heart that is blocked. And my mom is calling me. Can you hold 1 sec, please? Let me.
Absolutely, absolutely. Do you wanna reschedule?
I don't think he's taking care of it. I
Okay,
don't think he's in risk. It's just I want
take
just
your time.
tell me 1 sec, and
Take
I'm
your time. Yep,
please.
yep.
Thank you. Thank you. He's stable.
Is he okay?
Yeah, yeah.
So sorry to hear that, Eva, that's horrible.
Yes.
Like
Yes.
like, no, the fact that he's in hospital is horrible, not the fact that he's stable, of course he's stable,
Yeah,
that's
I know,
great.
but unfortunately, he found these 7 arteries on time
Yeah, thank goodness.
before every heart attack, so they
I
can.
know the feeling. My father actually passed when I was 25 from a massive heart attack. He was 54, so that was in between my emergency surgeries, so I understand that, it's very difficult. Yeah.
Yeah. Okay. Let's.
Try to get
Okay.
back to where we were.
Yeah. Um, with your answers, make me curious.
Mhm.
So many things. First, it's complicated that people has his medical history public. How that works, and most important, how the health business help with that.
Okay, so and that's a great question, right? Because we all have a very different medical history and profile. So this basically the system is designed to keep it simple for patients. So they are, each of us have the opportunity to list the information or check off basically the information in the profile that would be pertinent to you. So we've created, like a form basically within the system that you just kind of go through. We walk you through. It's very simple, but there's areas in there where you can customize it. So, for example, I can put in, my past surgeries and the year I had those surgeries and what those surgeries were. I can even add in notes about why I ended up having it to give them a little bit of history about my conditions. So, but it's basically, more triage emergency use so that people know right away what's going on. Once they get you stabilized, then, you can have deeper conversations into more critical areas or, deeper discussions about those areas. But, I think the purpose is to reduce the frustration around having to constantly repeat yourself, right? The other one is to provide greater awareness as soon as you can to reduce the triage time and the amount of time it takes for them to get you stable or to get through those initial triage questions so they can move on and get you, diagnosed and get care for you. And it's certainly, you can change that information as you go along, as you use the card. The healthcare system itself is a very challenged system. Wherever you go, everyone's got a different system and no one's connected. So this is an independent system that does not have to connect to the existing systems within that clinic or that hospital, right? It's completely independent but it still gives them the information they need right away so that they can help you. So it speeds up a lot, it saves a ton of time. It doesn't have the complexity of having to plug into a system that they wouldn't be compatible with because as we know, technology can be challenging, right? And so if you go to Peru, if you go to another country, they aren't going to know your information,
Yeah.
even out of province, out of state, wherever you are, then they're not going to know. And they won't have access to your medical files with your doctor. So if you can carry that information with you, that's huge. That's very valuable, right? And it's peace of mind for your family. So,
Yeah. Yeah. Yes.
you can
Yes.
speak on their behalf if they can't speak themselves. Like my
Mm.
daughter has a copy of my card. And then, if anything happened to me, God forbid, they can call her and she can scan the QR code on the card from wherever she is. And she can talk through with things for me if I'm unresponsive or, anything happens. So I think that the peace of mind and the awareness that you can give through an independent system like this is very powerful, right? Saves time, saves money, saves resources. But I think the greater part is just having peace of mind because this is our body, like it's your body, right? So if anything should be important to you, it should be your health, I would think, and making sure that they're getting the right information so that you aren't going to be dealing with unexpected allergies or reactions to different medications that you shouldn't be having. So I think a big question is, well, how do I know that it's going to be accurate? Well, as a patient, I don't think patients are interested in providing the wrong information about their own body because it would only do themselves harm.
Correct.
Right. So they're going to want to, and we send out, regular reminders to make sure your emergency profile is accurate and up to date with the current information so that if anything happens, then they will have that correct information at the time.
Yeah. And it's important, I think, because that give kind of to the user, to the people, an
Mhm.
authority or how to say an ownership of their own health. And
Absolutely. Yeah.
because I don't know, I'll give you an example. In Latin
Mhm.
America, as it is,
Mm.
every information of yourself belongs to the clinic or to the insurance, and they don't communicate each other. So if you attend is someplace and they know something about you, they don't share that information to you even though it's your health.
Yeah. Yeah. So you're absolutely right. There are people walking around that don't have access to their own medical records.
Yeah.
And if they don't have a doctor, right, then where is that information for other people to even be able to help you or for you to help yourself? Certainly wherever you are, it's important to advocate for yourself to make sure that because you're the one dealing with any breakdowns in the system. Like it's your body, it's your health that is
Yeah.
obviously affected. Right. So you're going to want to make sure that you can advocate for yourself. And if you're in an emergency situation, Evo, you're not thinking clearly. I've been there so many times. And if you're not thinking clearly, you're probably not answering the questions correctly either. So if you can have a system and this card that's already pre-populated with the accurate information of, let's say, your medication, the exact name of your medication, the dosage, and the frequency you're taking it and the reason you're taking it, then that gives them clarity to be able to help you. So, it's all about advocating for your own health, but doing it in an efficient way that will save you time, save them time. And at the end of the day, it'll give you peace of mind. Yeah.
Give you power
It
somehow.
does give you power, right? Because let's say you're not happy with the doctor you have
Yeah.
and you want to go to another doctor, right?
Yes. Moving a little bit about business itself. What are the biggest challenges in this type of business?
In healthcare, it's always, one of the biggest, I would say, challenges, but the more important factors is compliance and regulation, right?
Okay.
So that's really important. Obviously, it's private health information that we want to make sure we're safeguarding carefully. That's always a big, priority for me, obviously. And I think the second one would be awareness, education around something new, right? That people aren't used to a system like this. They've never, and certainly in Canada, I know I know for a lot of people, they're used to being able to just rely on the doctor and the doctor takes care of everything and I don't have to worry about it too much. But things have changed quite a bit over the years. And, the healthcare system is challenged. It is burdened. It is, since COVID, doctors are burned out. There's staff shortages. There's all sorts of different things. And we've had to really step up as patients to take a greater part in our own healthcare. And part of that is advocating for ourselves and making sure, that our medical records are accurate so that we can help ourselves and help them help us. So I think that, yeah, number one is compliance and regulation always first and foremost for me. And then, keeping it simple, but educating people so that they have a greater understanding of what this is and how it works. Because it is new and they just don't know, right? So the brand awareness is definitely out there now and certainly caught on, and which is a great thing. People, they hear of my 911 or my 911 life. I've heard of that, and I'm like, oh, that's good, because I've worked really hard at building the awareness around the branding and the service itself, what we do and how we help people. So I think that's the biggest thing is the education piece now.
And that's bring me another question. What is your target in terms of a population? Or do you have a specific demographic target?
That's a great question. I get that a lot actually. Who's your ideal client? Well, I know, and you shouldn't just, throw it out to everybody, but I
Yes.
think, yeah, right. I mean, a lot of seniors obviously who are going to need caregivers. The caregivers are an important role that play in the help of patients, obviously. We have an aging population and, at some point we're all going to need help in caring for ourselves. And so that might mean bringing someone else in, a family member or a professional to take care of us. So if we can give them the tools like this to help them manage that information in a more efficient manner, especially if they're caring for more than one people, I think the senior population for sure. And you've got Alzheimer's and dementia and different conditions like that where they can't quickly recall the information they need to share. This is really important for them so that they don't have to think about that too much and worry about it. I think for anyone who's got disabilities, obviously who needs assistance to back up what they have going on. You've got a lot of young children with a lot of disabilities that their parents are their caregivers. And what happens in the situation if something happened to the parent? Then who takes care of them? And do they know everything about them? Right. And what their needs are. So I think it can apply to a lot of different areas. If you're single and you have no one around who can speak for you, it's kind of your second voice, right? So I think there's a lot of different cases for where this can be quite useful.
In your experience, what separates a company like this? What are your ways to differentiate yourself as a brand from your competitors?
The biggest thing is I'm giving control back to the patient, right? I'm putting the control back into the patient's hands. So
Yeah.
you get to control the information that you need to share. You're not relying on systems that may have added notes in there that may not even be pertinent to the situation you're in, that you don't want to share. It could be too sensitive. I've talked to a lot of people and their inability to have that control is really scary for them. So they love the fact that they can control the information on their own healthcare file and that they know where that information is, that they own it. I don't own it. They own it. I safeguard it, but they own it. And, certainly since COVID, there's been a lot of trust issues and uncertainty in healthcare. And this gives them that back. And it provides not just a digital profile summary, but it gives them a physical wallet card, right? That is instant, that they can carry with them quickly. So I know there's a lot of questions around that and how that's kind of structured and set up. But if you're out kayaking, let's say you want to go kayaking and you don't have you have to wrap everything up carefully so it's not going to get wet. But if you're out boating, kayaking, whatever that is, these wallet cards are waterproof as well. So, and you can wear a lanyard with them so that you can just have it tucked in behind your life jacket or whatever. And everybody will know where that is. You just have to make sure that you're letting everyone know, what is your emergency preparedness solution so that if anything happened to you, they would know where to look and what to do. But it's, having the physical backup as well as the digital, I think is very, very important. And I think that's kind of the difference. As well as, again, the biggest thing is giving the patient control over what they choose to share.
Yeah.
Yeah.
And first of all, how do you market? What is the marketing? How do you marketing my 911?
I spent a lot of time, obviously, on my social media channels, building those up. Just going out to different events and introducing myself and what we do. We've had the magazine covers, which has been incredible. I was a little surprised to get those. I had Forbes and Business Insider. Those were massive, massive coverage, which was really great. But I think just constant discussions, podcasts like this one, getting out and speaking to people, and as a vendor, setting up a table and just going out and meeting people at different events to share the story of my 911 and what I do and why I'm doing it and why it's important to be prepared for your own health and the different benefits that you can get from being prepared with a service like ours. So it's just a lot of discussions and meeting people and networking, and the social media is huge, obviously, but yeah,
And you
just
have
yeah.
and that is important to our audience. Every entrepreneur that I have interviewed all use social media, even
Mhm.
myself, right?
Yeah.
There's products and services that has a click to everybody. And this is one of these. Who doesn't want to pay attention to their health?
Right?
Who
Yeah.
doesn't know that that information belongs to them? So in order to do so, that is when the social media is have power for this kind of products and services, right? To
It
me,
does.
just is the right channel, I think, to go broad, right?
Well, and it's consistency as well, right?
Of
When
course.
people see you and they hear you speak, and going out, I've got a speaking engagement at the end of May I'm doing as well, and it's just getting out and continually sharing the story and being consistent and being out there, really, so that people continually see you and then they say, oh yeah, I've heard about you, or I've heard about that. I've had that a lot. So that's really nice, because then it's working, right? The education is happening, it's working, people are seeing you, they recognize you, they ask you certain questions, but more importantly, they're becoming better educated around their own health. And that's, I think, the primary reason is to give them greater awareness around their own health and to help their families, because without our health, we don't have anything, right? It is our number one. And if I can play a small part in that through this service, it's very humbling, and I'm really, really happy to be able to do that for people. So
Yeah. Michelle, how do you get that leads? How do you get people interested? Do they come into the web, signing,
Mhm.
or you have a call center? Can you explain us a little bit how is the process from getting a call or a lead or I don't know, or a sign up, and how the call comes into to the job
Mhm.
it needed, how the
Mhm.
end product finish for so to speak.
Yeah, yeah. So, yeah, people usually go to the website, and you register right on the website, and then what that does is you go through the payment process like you would any other purchase online.
Mhm.
And then when that happens, you get a confirmation email of your purchase, and that directs you to your new emergency profile on your account online. So then you log in, and then you just start going through the steps. We guide you through, of course, our form to complete your emergency profile. And it might take a while, right? Because, you have to gather some information, either some medical records or really important information that you want to make sure you're including either on your card or your profile. And once you have your profile complete to where you need it to be, and again, it's, Evo, it's the questions you're always asked when you go anywhere. What are your allergies? What medications are you taking? Do you have any underlying conditions? All those sorts of things. When did you have your last vaccination, on whatever it is? And once you've got your profile complete, then you basically review that summary to make sure it's accurate. And then you send your card for printing. And then once your card is sent, it's custom prepared for you according to your instructions, because you're the one choosing specific items that you want printed directly on your card. So, for instance, if you were a diabetic
Yeah.
or you had a heart condition, that's information you're going to want them to see right away on your card without having to scan a code. So, but once you send your card for printing, it goes to manufacturing, and they custom print your wallet card to your specifications, and then it's mailed to you. in a confidential envelope. And then you get your card in the mail and you log into your account and you just activate the QR code online on your account by the click of a link. And then it's ready to go. You can just use it and update it and anywhere you are. Very simple. Very
Yeah,
simple.
yeah,
Mhm.
yeah, yeah. That's it should be.
Yeah. Yeah.
Tell me one thing. It only works in Canada?
No, I mean, I was in Abu Dhabi last year for the healthcare conference there. And if anything had happened there, the gentleman who had invited me over to attend this conference, he could have just scanned the code for me and it would have popped up on his phone.
Yeah, but what I mean, for a being a user, do you have to be as a Canadian?
Okay, so I'm sorry. Yeah. So for my911.ca, that is for Canadians,
Mhm.
that website, and then my911life.com is currently open in Florida but in the United States.
Oh,
So, yeah, it's for the US citizens, yeah. So, but it'll work anywhere, but you're right. Yeah, you have to be, either a Canadian or American citizen at this point. Yeah.
okay.
Yeah.
In this process,
Mhm.
is there any struggle that you have?
Well, there's been lots of challenges. Absolutely.
I
You
love this
learn.
question. I love this question, but
I
because you
love
know
this
what, as
question.
entrepreneur, there is no one to tell you,
Wow.
no, you see, everything's perfect.
Oh, no. You know the graph where it shows, either it's just one way straight up or it's all the this has been this. Yeah, because it's never been done before, so there was a huge learning curve not only for, development, but myself, and, like, I knew what I wanted. I saw what I wanted,
Yeah.
to create it because I came from a patient perspective, so I knew what I wanted as a patient. I knew the problem I was solving, right? Was to streamline medical communications through systems that are not connected and to create basically a mobile healthcare information management system that gives each end user full control over the medical information that they choose to share. That was a challenge, right? It's technology. So trying to figure that out and in making sure the compliance and regulation and privacy and security was in place at every step. Those are different hurdles that you have to go through to make sure everything is still functioning the way it's supposed to, but I'm still getting the end result that I want. Tons of challenges. And, also the education piece around trying to help people understand, why being prepared in advance is so important because most people haven't had any healthcare issues. So they would say, well, I'm fine. I don't need that. Right. And I was fine until I wasn't.
Yeah.
And then I quickly realized, and it's no different than having car insurance. You pray to God you never use it, but it's good to have and you need to have it. In this case, it's not a legal requirement, obviously, but it's your health. So it is important to, you pray you never have to use it again. But of course, we will end up using it because our health does change as we get older. So tons of challenges, various entrepreneurial challenges for sure. But, the journey has been very educational. And when I see the end results and I talk to members, Evo, there's no greater feeling than knowing that you could be helpful in providing something that would save people or make their healthcare situation more peaceful because it's always going to be difficult and emotional, but if you can help them in any way to improve their lives at the end of the day and their experience as a patient, it is priceless.
Yeah. Yeah. Yeah.
Yeah.
Yeah. I'm really, that is the most novel project that I have interviewed, to be
Oh,
honest with you, because it's
thank
just,
you.
yeah, and it's functional and it makes sense and it's power, has everything. Listen, I have so many questions. How big are you? How big is this? How many,
Well, you know what?
how
That's
is the team or
a
how you
loaded
manage?
question because yeah, no, it's a good question. It's a loaded question because it's a very self-directed system. So in my vision, it was just to keep it very streamlined. I run
Yeah.
a lean, mean machine, obviously. But yeah, no, the support is there. I've been able to create a really good team of people that, obviously help
Yeah.
making this come to fruition. So and it's just everything's going to keep growing as we go along and, but it's again, it's patient first. It's keeping it simple.
And that's, I guess it's technology. So you have a very have remote team, I guess, where
Yeah,
you manage everything, and that make it easier in that way.
I've got a great team. Yeah. No,
Yeah.
I'm very, very blessed, Evo, to have, incredible people that I've been able to collaborate with to get this work done.
Yes.
Super blessed, super, super blessed. And, they realize the importance of this work. They understand why I'm so passionate about doing what I'm doing and the reason for it. When you've had to go through all these healthcare challenges yourself and go through the loss of someone very close, like my father when I was young, extremely unexpected, you just look at life differently. Right? You don't look at it the same. And thank God we have such great healthcare professionals. I couldn't do what they do. I'm so grateful for them. But as a patient, I come at it from a patient perspective. So to me, it's got to be simple, it's got to be effective, but I want control because we all learned through COVID we have no control over anything. And really, when it does come to your health, we don't have control over that either. But the information that we need available, we can control. And what a great, efficient way to do it, right?
Yes. Marketing way. Is it-
I can
Yeah,
see the wheels
I,
turning,
want
by the way.
I want to ask about film, but I have to focus on my on podcast.
I can see the wheels turning.
Yeah, yeah. My brain is like in your flow of marketing for our
Yep.
audience to understand. When the leads come, I guess you don't have 100% conversion, right?
No, and when it
But
takes
it's pretty
time.
high.
It takes time because, people, again, I've got to educate them. And everybody, if it's a company, they're going to have different outcomes or priorities for them and their staff and maybe how they want to do it, right? So there's lots of different ways, to structure this, but again, it's listening to what people are looking for, having a clear understanding of what they need and where that gap is. Once I understand what they're looking for, then, we can work together. But it's a big piece is education around this because it's not new. I'm sorry, it is new, but it's not something that people are thinking of all the
Yeah,
time. Like
yeah,
they're just not, right? But if you can ease the burden, even when you go to a hospital, if you can ease the burden from, with the nursing staff having to ask these same questions all the time. I did have that scenario where one of my members said the nurses were saying like, this is amazing, because it saved them so much time. And it was clear because it came from the patient themselves. So there was no guessing. There was no wondering, what's going on. Like I said earlier, I'm not going to populate inaccurate information on my own medical profile because that only does me harm. So
yes.
what I populate is going to be accurate. And that's, obviously that's important. So
And how important are systems and processes in a business like this?
it's super important.
And how do you manage? Do you have
I
how do
just
you
I
do that?
naturally I well, I think I just naturally knew what I wanted to accomplish, number 1. Uh, it's a very, I've simplified everything that I do, and I'm just used to it. I'm used to creating structures and systems, and I just needed to create one that aligned with this business. I used to do it in wealth management all the time for our team. When I was the team manager there, I created a lot of different systems that everybody probably still uses. But so when you get in that mindset of just creating something that is smooth and efficient, your brain is wired that way. My brain is wired that way to just create simplicity. Yeah.
Yeah, and that's hard.
It can be, but
A quote, I don't know, remember where, but be simple or do simple things is more complicated,
can be. It
right?
looks simple from the front end, from what everybody sees,
Yes.
but you're 100% right. Behind the scenes, creating that simplicity is very complex. So as you break it down, you have to break it down into different steps. Yeah, I mean, it looks easy, but
Hmm.
there's been a lot of thought and research and preparation behind the scenes to make it easy for people. Yeah.
And what part of the business still depends the most on you? So what is you spend the most of your time?
Well, I'm the voice.
Yeah. So Mark.
I'm the face of the business. I'm the voice of the business because it's coming from me. The story comes from me. The reason why I'm doing what I'm doing is my story. So it's my job to educate and great, to provide that awareness for people and to help them understand why it's important and how it can benefit them and their families. So I think that's the main thing is I'm the spokesperson for it and to make sure that the word is getting out there and I can answer any questions anyone has because I've created it, you know, I've designed it. I've enjoyed creating it. It's been a fun process. So yeah, I'm basically the spokesperson for the company. Yeah.
If you could fix one thing in your business, what it would be?
If I could fix one thing, there's always room for improvement. Always. If I think speed, but when you create something that's never been created before, you often hear that saying, Rome was not built in a day, right?
Yes.
And it takes time to build great systems. And I prefer quality, solid foundations. I always wish I could go faster, I think, if anything, but it takes time.
Yes.
It just takes time.
Two more questions. If demand double tomorrow, what will be the hardest things to manage?
If it doubled tomorrow, I think just again, it's just the creating that. I don't know. I've set the systems up pretty good for scale already. So I think it's maybe being able to talk to everybody as quickly as I want to, if anything, But I've built it for scale. So I'm excited actually for that. I'm very excited for that. But yeah, no, it was designed for scale. It was built for scale. And so it's, yeah, no, I don't really have too many concerns that way. I think if anything, it's just more, dealing if everybody wanted to talk to me all at once, that would be challenging. Obviously, the meetings would be set up or different calls would have to be set up. But yeah.
What mindset has helped you handle growth and challenges in your business?
Trusting the process, having faith in what I'm doing, and believing in myself enough to be able to do this work. Because again, it was not something that I sought out to do. It was a deviation from
What you've been
wealth
doing?
management completely. I mean, I dove into this, not really knowing very much either, except from a patient lens. So to me, it was a lot about trusting that I could do the work and proving to myself that I could do the work and overcome the challenges that I certainly knew were ahead. So I think when you learn to trust yourself and you learn to build the confidence, which does take time, I think, because we all have insecurities in what we might be able to accomplish, because I mean, I didn't know where this was going to be going, but then it's trusting the process and just staying true to kind of what I call my North Star, which was the end result of streamlining medical communications for people and making sure that the patient always came first in this. So I think, yeah, just building those natural strengths and believing in yourself and trusting the process. Yeah.
Because
Well, I think that, I have a deep-rooted faith in what I'm doing and why I'm doing it. So that is 90% of it. But I think it just takes time because I didn't have to do public speaking before this. So that takes time, right? You have to learn a lot of new things and take, those unknown risks about, being very vulnerable and putting yourself out there for people to criticize and judge. And everybody has an opinion, which is fine. But I think focus and discipline and, I'm really hardcore on that. I'm very, very self-disciplined and I know why I'm doing this and I know the benefits of why I'm doing this. So that's why I am so steadfast in this, because as a patient, it can be very, very difficult. And there are challenges. I think I never wavered on why I was doing this. I never wavered on the benefits of it or the end result ever, because I knew why I was doing it.
Michelle, thank you so much.
Thank you, Ivo.
Thank you so much. Guys, I expect you enjoyed it. See you next time.
Thank
Bye.
you, Ivo. Take care.